The basic principle is the same story of taking plenty of vegetables, fruits, whole grains, dairy, lean protein, and healthy fats. A healthy pregnancy diet will promote the growth of your baby. Nutrients are substances that are in foods which our body needs for the function and growth. This includes carbohydrate, fats, protein, vitamins, minerals, and water. Nutrients are more important than usual when you are pregnant. You need more nutrition than you took before the pregnancy. With a healthy choice of food with nutrients will help you and your baby to grow properly. It will also ensure that you and your baby gain the correct amount of weight. Moreover, do you know that you have to take some special nutrients as you are pregnant now? During pregnancy, you need folic acid, iron, calcium, vitamin D, choline, omega-3 fatty acids, B vitamins, and vitamin C. These nutrients should be taken properly and in correct recommended amounts. Also keep in mind that taking more than recommended can be harmful, as too much of anything is good for nothing. Plan your diet accordingly. Here what you need to know. Calcium. You and your baby need calcium for the growth of strong bones and teeth. It ensures that your circulatory system, muscular system, and nervous system is functioning properly. Calcium also reduces the risk of preeclampsia, which is a medical condition that caused due to sudden increase of blood pressure during the pregnancy. Calcium is not prepared inside your body, so you want to get it from food or supplements. During pregnancy, try to consume at least 1,000 milligrams of calcium regularly. If you're 18 years or older, you still need about 1,300 milligrams of calcium. Dairy products like milk, cheddar, and yogurt are probably the best sources of calcium. Blunt, leafy green vegetables also contain calcium, but in much more modest amounts. Some food sources contain calcium, including oats, bread, orange juice, and calcium-fortified soy drinks. Check food labels to be aware without a doubt. Few examples are 299 milligrams of milk, 8 ounces non-fat. 253 milligrams of tofu, half cup, firm, made with calcium sulfate. 181 milligrams of salmon, 3 ounces canned with bones. 100 to 1,000 milligrams of cereal, 1 cup of calcium-fortified types. 9 to 4 milligrams of kale, 1 cup, cooked. 80 to 500 milligrams of soy beverage, 8 ounces, calcium-fortified. 74 milligrams of bok choy, 1 cup. Raw breastfeeding also needs calcium. You should not stop calcium intake while you're breastfeeding. Iron. At the time of pregnancy, you need about twice as much iron as before because your body uses iron to make extra blood for your baby. But about half of pregnant women don't get enough of this important mineral. Your body uses iron to make extra blood for you and your baby during pregnancy. Iron also helps carry oxygen from your lungs to the rest of your body and your child's. Adequate iron intake can prevent a condition of low red blood platelets, which can cause a feeling of fatigue known as iron deficiency pallor. Weakness can result in your child being conceived too little or too soon. You should consume 27 milligrams of iron per day, such as dark green, leafy vegetables, citrus fruits, enriched breads or cereals, lean beef and poultry eggs. Iodine. The work of iodine during pregnancy is of exceptional interest, as this halogen is involved in the enhancement of the focal sensory system during the undeveloped, fetal, and post-pregnant stages. Adequate iodine intake during pregnancy is fundamental to ensuring legitimate mental health, and its lack of basal periods causes irreversible damage. Iodine-rich foods are iodized table salt, dairy products, seafood, meat, and eggs. 220 micrograms of iodine are necessary for a day. Choline. Choline is important for development of your fetus's brain and spinal cord. Choline is changed over into a synapse that helps muscles agreement and assumes a part in mental health, including memory and thinking. You might have the option to get sufficient choline by eating a fluctuated diet, Yet numerous pregnant ladies don't get sufficient choline from diet alone and may require a supplement. Foods with choline are milk, beef liver, eggs, peanut, soy products. It is necessary to take 450 mg of choline per day while pregnant. Vitamin A vitamin forms healthy skin and eyesight of the baby, and it is recommended to have 750 micrograms for pregnant women between the age 14 to 28 and 770 micrograms for women between 19 to 50. Vitamin A foods are carrots, green leafy vegetables, sweet potatoes. Omega-3 fatty acid. The unsaturated omega-6 fatty acids contained in vegetable oils support the heart and have a decisive influence on the cholesterol level in the blood. Taking the prescribed amounts during pregnancy will help build your child's reserves prepared for life after birth. Vitamin C. During pregnancy, vitamin C is essential for both mother and child. You want it for tissue repair and wound healing, and it also helps your child's bones and teeth grow. Vitamin C also supports the body's own collagen formation, helps to intensify feelings of numbness, and ultimately also influences your ability to store iron. Food which has vitamin C are citrus food, broccoli, tomatoes, and strawberries. It is recommended to intake 80 milligrams for ages 14 to 18 pregnant women and 85 milligrams for ages 19 to 50 pregnant women. Vitamin D. Vitamin D work together with calcium for the growth of baby's bones and teeth. You should take 600 international units a day while pregnant. Some of the food which have vitamin D are fatty fish like salmon, fortified milk, and orange juice. Many people do not take adequate amount of vitamin D, and if you are pregnant and you think you do not take the adequate amount, you must use supplements. Vitamin B6. Studies suggest that taking vitamin B6 for morning sickness increases nausea, but not nausea, in most pregnant women. There was no evidence of damage to the embryo when using vitamin B6. It also helps form red blood cells and helps body use protein, fat, and carbohydrates. During your pregnancy, vitamin B6 is essential for your child's creative brain and sensory system. It also helps your child consume protein and carbohydrates. You should be able to get all the vitamin B6 you really need during pregnancy from your diet routine and prenatal nutrients. You have to eat beef, liver, pork, ham, whole grain cereals, bananas at an amount of 1.9 milligram per day. Vitamin B12. The foods contain vitamin B12 are meat, fish, poultry, milk, and vegetarian pregnant women must definitely take supplements, and it is recommended to take 2.6 micrograms of vitamin B12 per day. Folic acid. Folic acid may help reduce the risk of ruptured brain tubes, which are birth defects of the brain and spinal cord. Imperfections in the cerebral tube can result in varying degrees of limitation of movement, incontinence, and sometimes conscious disability. Folic acid is most supportive in the first 28 days after conception. Unfortunately, you can't tell you're pregnant for 28 days. That way, your intake of folic acid should begin before you give birth and continue throughout your pregnancy. Your healthcare provider or obstetrician will suggest the right dose of corrosive folic acid to meet your individual needs. For example, women taking anti-seizure drugs may need to take larger amounts of folic acid to prevent brain tube deserts. They should talk to their doctor while trying to visualize. Regardless of whether you have a good eating routine or not, you can miss out on important nutritional supplements. Daily intake of a prenatal nutrient in perfect world, beginning no less than 90 days before origin, can help fill in the gaps. Your medical provider may suggest exceptional improvements if you are strictly vegetarian or chronically ill. Nutrients and minerals play an important role in all your body's abilities. Eating quality foods and taking a nutrient regularly before childbirth should provide all the nutrients and minerals you need during pregnancy. Maintain a proper, nutritious diet throughout your pregnancy so that you and your developing child can basically be as strong as you would expect. Incorporate whole, sustainable food sources and reduce your intake of food sources with little nutritional benefit, such as processed and fast food varieties. Above all, be mindful and follow your doctor's advice.